Hey, this is Dr. Ranicki with Dr. Ranicki's Creating Wellness Center in Savannah, Georgia. Very often, patients will tell me that they cannot get chiropractic care because they've had spinal surgery. And the truth is that if you've had spinal surgery, you can receive chiropractic care, and it may be even more important than ever for you to receive chiropractic care, but it is very, very important that you see the right chiropractor for that type of an issue. So there are some chiropractors out there that don't do any x-rays. And if you've had spinal surgery, whether it's a fusion or a laminectomy or some other procedure like that, then having x-rays I think is a very, very important thing. There are also chiropractors that they do pretty much the same thing to every patient every time. It's always a twist your left, twist your right, crunch, crunch up the middle, take your head, twist it this way, twist it that way sort of thing. And that's not the right tool for somebody who's had spinal surgery. They might be helping lots of other people, but it certainly is not the right tool for somebody who's had a surgery. I have other people who tell me that they tried to go to a chiropractor and the chiropractor said, no, you've had surgery, I don't want to touch you. And perhaps that particular chiropractor shouldn't, because they realize that the way they do things is not the right way to do it for somebody who's had surgery. But there is a right way to care for somebody who has had surgery, of whatever type. So if we're talking about somebody who's had a fusion, where they pulled the disc out and they fused two bones together, whether that be with packing bone fragments into the space the disc used to be in, or whether it be that they put in plates or rods and screws, then obviously we're not going to adjust those particular bones. But adjusting the ones just above that and just below that becomes now even more important. Because the reality is that you're still going to be turning to look over your blind spots, you're still going to be bending to get to things low, you're still going to use your body in the ways that you've always used it, but now those two bones are not able to move anymore. They're fused together. So the joints just above and the joints just below are now having to take up the slack. They're having to do more movement and more work to allow you to still be able to turn and check your blind spot, and that puts extra wear and tear on those. And so one thing that we see very commonly is that when a person has had one fusion, that it tends to spread up and down the spine. That the next joint up gets extra damage and the next joint down below gets extra damage, and they are very quickly now in the same predicament that the original joint was that they got fused. But chiropractic care can protect those joints above or below so that you don't wind up having to go back under the knife and have another fusion. There are medical doctors that will work with chiropractors and will get the understanding that the chiropractor is not going to just twist this person in every direction possible and do something to damage the surgery that's been done. But other medical doctors don't look into the issue at all, and they assume every chiropractor is just twisting everybody in every direction, not bothering to take into account what needs to be done differently in this situation. But chiropractors have a lot more expertise than I think is realized by the medical world, and we certainly have the ability to say, this is somebody who still can be adjusted, but we need to do things differently. Maybe we need to not use our hands to adjust, but we need to use a little instrument where it only delivers a light little tap. Or maybe we need to avoid this particular section altogether, but we can work on the areas above or below that. There's a right way to do it, and we've had patients with all kinds of different surgical implants put inside of them, and we've still found a way to get them very good results, a lot of help and improvement. I've had patients that have had fusions and have gotten zero relief and zero benefit from the fusion. I've had patients that have gotten fusions and are now even worse as a result of the scar tissue created by the surgery. And we've still been able to get very good results for those people where they've been able to back off of a lot of the heavy painkiller medications, opiates and things like that they were taking, all without putting them at any risk of any danger. But it has to be done wisely. It has to be done in a case-by-case basis of what's appropriate for this particular patient who's experienced this particular type of surgery. So if you've had any kind of surgery on your spine and you're wary about getting chiropractic care, but nonetheless still feel like you've got a lot of help that you need, I would encourage you to talk to us at Dr. Ranicki's Creating Wellness Center in Savannah and see if you're a good candidate for chiropractic care, and if so, what would be the right way of caring for you. Thank you for your time and attention. Feel free to post any questions or comments below, and we look forward to seeing how we might be able to help.